You're running through a forest 50,000 years ago. A branch tears across your arm, deep, bleeding, no hospital, no doctor, no antiseptic, no bandage. Just you, the wound, and a group of people who have absolutely no idea what bacteria is, but have watched enough people die from small cuts to know that this moment matters. What happens next is one of the most fascinating and genuinely surprising stories in all of human history, because ancient humans didn't just survive wounds. Some of what they did actually worked, and the reasons why are stranger and more impressive than anything you'd learn in a standard history class. Start with the immediate reality. A wound in the ancient world was not just painful, it was a potential death sentence. Not from blood loss necessarily, although that was real, but from what came after. Infection, the invisible killer that ancient humans had no name for, no understanding of, and no ability to see. They only knew the outcome. A wound that looked fine one day, looked angry and swollen the next. A week later, the person was gone. So what did they do? The first response was almost certainly the most instinctive one. They cleaned it, not because anyone told them about germ theory, that was 50,000 years away, but because something in the wound that was dirty felt wrong. Running water was used to flush wounds long before anyone understood why running water helped. The behavior was right, the understanding was completely absent. Then they stopped the bleeding. Pressure. Direct hand pressure on a wound is one of the oldest and most effective emergency medical interventions that exists. It requires zero knowledge. It requires zero tools. And ancient humans figured it out immediately because watching someone press a hand against a bleeding wound and watching the bleeding slow down is a cause and effect relationship clear enough for any human brain to learn in a single observation. Plant materials were used to pack wounds, moss, leaves, bark fibers, creating the earliest version of a bandage. Not because anyone designed them that way, because they were available, absorbent, and they worked well enough that the people who used them survived more often than the people who didn't. Here's where it gets genuinely interesting. Archaeologists have found evidence of ancient humans treating wounds with specific plants that we now know have genuine medicinal properties. This wasn't random. This was accumulated knowledge, thousands of years of watching which plants helped and which ones made things worse, passed down generation to generation without a single written word. Yarrow, a plant found across Europe, Asia, and North America, has documented blood clotting and antimicrobial properties. Its ancient name in several cultures literally translates to woundwort or soldier's woundwort. It was used on battlefields for thousands of years before anyone understood why it worked. We now know it contains compounds that actively help stop bleeding and inhibit bacterial growth. Honey. Ancient Egyptians documented honey as a wound treatment in medical papyri dating back 4,000 years. And they weren't wrong. Raw honey has genuine antimicrobial properties. Its high sugar content draws moisture out of bacteria, dehydrating and killing them. Its low pH creates an environment hostile to bacterial growth. Modern medical research has confirmed that certain types of honey, particularly Manuka honey, are effective enough against antibiotic-resistant bacteria that they are used in clinical wound care today. Ancient humans used honey on wounds because experience showed them it helped. They had no idea they were doing antimicrobial chemistry, but they were. Then there is the most extreme ancient wound treatment, and this is the one that will genuinely make you uncomfortable. Maggots. Before you dismiss this, hear the science out. Archaeological and historical evidence shows that multiple ancient cultures independently discovered that allowing certain fly larvae to inhabit a wound actually helped it heal. The Mayans, Aboriginal Australians, ancient Chinese physicians, medieval European battlefield surgeons, all separated by thousands of miles and thousands of years, all arriving at the same deeply counterintuitive conclusion. What they observed was that wounds with maggots healed faster and got infected less often than wounds without them. What they couldn't know was why. Modern medicine eventually explained it. Maggots of certain species, particularly greenbottle flies, eat only dead and infected tissue. They leave healthy tissue completely alone. They also secrete compounds that actively kill bacteria and stimulate healing in surrounding tissue. Maggot debridement therapy, the clinical term for intentionally using maggots to clean wounds, is a currently approved and practiced medical treatment in the United States, the United Kingdom, and across Europe. It is used specifically for wounds that don't respond to antibiotics. Ancient humans figured this out through observation alone, multiple times, independently, without any of the scientific framework that would later explain why it worked. Now talk about surgery, because ancient humans didn't just treat surface wounds, they performed surgery, and the evidence is as extraordinary as it is disturbing. Trepanation, the practice of drilling or scraping a hole into the human skull, is the oldest documented surgical procedure in human history. Archaeological evidence shows it being performed on every inhabited continent. The oldest confirmed example dates to approximately 6,500 BC in what is now France. The patient survived. We know this because the bone shows evidence of healing around the opening, bone regrowth that only happens in living tissue. They drilled into a human skull 8,500 years ago. The person lived. No anesthetic, no sterile environment, no understanding of the brain, just a stone tool, accumulated experience, and a patient who somehow made it through. Amputation is documented in ancient populations as well. Evidence of healed stumps, bone ends that show the rounded regrowth that only occurs when a person survives long term after a limb is removed, have been found in archaeological records going back thousands of years. Someone lost a limb, someone else helped them survive it. In a world without antibiotics, without blood transfusions, without surgical anesthesia, how they managed pain at all during these procedures is its own remarkable story. Alcohol, fermented beverages of various kinds, is documented as an ancient anesthetic. Various plant compounds with narcotic or sedative properties were used in different cultures. Cannabis, opium poppies, henbane, mandrake. Ancient surgical patients weren't fully anesthetized in the modern sense, but ancient physicians weren't operating on people who were fully conscious and unmedicated either. Here's what all of this adds up to. Ancient humans had no scientific understanding of infection, bacteria, or cellular biology. They had no trained physicians in the modern sense. They had no sterile equipment. They had no pharmaceuticals developed through clinical trials. What they had was something that in some ways is more impressive. They had thousands of years of accumulated observation, passed from person to person, generation to generation, in an unbroken chain of practical knowledge that had been tested in the most rigorous way possible by watching people live or die based on what was done to their wounds. The knowledge wasn't written, it wasn't theorized, it was lived, and enough of it was correct that humans survived. Not just survived, thrived, crossed continents, populated the entire planet, lived long enough to pass on what they knew to the next generation. The next time you use a bandage or apply honey to a cut or hear about maggot therapy in a medical journal, you are at the far end of a chain of human knowledge that started with someone pressing their hand against a wound in a forest 50,000 years ago and noticing that the bleeding slowed down. They didn't know why, they just knew it worked, and they remembered.